Okay, so this is Van Herick. The slit is placed rightly at the limbus, and as you can see, the space between the corneal endothelium and the iris surface, just a dark space in between, that's our anterior chamber angle. That's our anterior chamber angle. Victory, can you minimize your rate of blinking, please? Thank you. Yes, so that's just the anterior chamber angle, right? Yes, so it's obvious that it's just like mostly 1:1, okay? So that means we are free to dilate this patient. There's not going to be any risk of angle closure, right? So it's almost 1:1. So just a dark space in between. The first layer we are seeing there, translucent layer, is just the cornea itself. So the first corneal epithelium, the middle stroma, and the backward one, the endothelium. Then the dark space is definitely the anterior chamber angle. Then the other brown bright is the surface of the iris. So if you can put 1 + 1 together, you understand that that's the anterior chamber angle. There's just a dark space in between. Okay, so the setting of Van Herick is definitely your slits, the thinnest, the narrowest slits, and you can adjust the height, and then you angulate your illumination from 45 to 60 degrees. So that's just it. That's how you definitely do your Van Herick. So just this simple procedure will save you a lot of stress and as well lawsuits, because if you mistakenly dilate a patient and it precipitates angle closure, if that patient is literate or educated enough, that's practically a lawsuit, right? So now, since we've known that we are safe to dilate, I'll straight ahead go and instill my dilating agent on the patient and wait for like 30-20 minutes of full dilation before I commence my fundoscopy using my slit lamp. So I'll be using Vox lens. I have my Vox lens adapter, which is fairly adapter, and I'm also using my Vox lens adapter, which is fairly Austin. Currently I'm also using my fairly adapter to cover this entire clinical procedure that holds in place my phone. So whatever it is that I can see through the eyepiece, I can as well use my phone to see it. So basically it's a kind of an interface, right? Manipulated interface. So right, I'll see you next when I dilate my patient and I commence my fundoscopy. So before I commence my fundoscopy, it's very important